Dr. Corey Maas on Looking and Being Your Best. I wanted to talk today a little bit about resurfacing, and there's a lot of confusion. I've done a lot of speeches about this, lectures and prior blogs about resurfacing. But there's a broad umbrella of resurfacing, and resurfacing really means that we're creating a controlled injury to the skin surface. And when we injure the skin surface in a controlled way, sort of like you skinned your knee, the skin surface will respond by making new collagen, by remodeling the existing collagen, and by populating the surface of the skin with a new layer of skin cells, brand new keratinocytes. And so what we've learned over many years is that doing resurfacing in a very controlled way down into the second layer of the skin, the dermis, and specifically the papillary, even papillary reticular dermis junction, can really improve skin quality, get rid of wrinkles and discolorations or dyschromias, and make the skin much better. And it doesn't matter if we go back to 5000 BC or 4500 with Cleopatra and her using sour milk to improve her skin quality, or we look to the more modern era where peels began to be used along with sanding of the skin, which was started in the even way farther back in the Indian literature, but started with literally using sandpaper to help smooth scars and irregularities, and ultimately more in the 50s and 60s was used even before, somewhat in the 40s, using a spinning wheel, a diamond phrase as what it's called, just like sanding would be done with woodworking or other types of things. And the skin surface injury in a controlled way, even mechanical injury, like with a dermabrader or spinning wheel, are very good ways to improve skin quality. Now the problem with the spinning wheels, the dermabraders is what the name of the tool is that when we spin, that's spraying tissue and things into the room, which in today's world, aerosolized tissue is not healthy. It's dangerous to workers and patients alike. So we've largely gotten away from doing dermabrasion, although it's still a very good tool. I don't want to impugn in any way its value, but for safety purposes, many of us are moving to other technologies. And in the 90s, peels and dermabrasion got supplanted by lasers, which many of us thought were going to be just the greatest thing ever, and we'd have much less side effects and much better recovery. And what we learned actually was that the amount of heat in those treatments when we were doing the entire skin surface with laser was so great that people were red for a really long time. And so that's why we came a year or more in some patients, which is still true to this day with full resurfacing techniques using laser. But many of us went back to doing chemical peels. But the broad umbrella that I started with are really three types of energy: mechanical energy, chemical energy, which basically removes the outer layers of skin, chemical peels, and light or heat energy or laser energy. Light heat, the same thing. The light energy is absorbed by the tissues, creating heat, which rapidly vaporizes skin cells. So with that as a background, knowing what resurfacing techniques are out there, I'll tell you that chemical peels are still a very important part of my practice, because the two main factors that impact outcomes when we do skin resurfacing are the surface area that's injured. In other words, how many square millimeters of the skin surface is injured, and then the depth of injury to the skin. And in general, the deeper the injury, up to a point, the deeper the injury, the better the improvement. But once you cross that point or that line getting into the reticular dermis, then you start risking hypopigmentation or lightening of the skin or even scarring, which we want to completely avoid if we're trying to make the skin better. And one of the values or important things about lasers is as you get good at them, we're able to know by settings and certain power values and certain visual feedback what the depth of injury is. And the thing that led us to using fractional laser, where many tiny little dots, but areas of uninjured skin are left behind, that's really what fractional laser resurfacing is, creates a layer of safety because the entire skin surface is not injured in fractional laser. but it also means we're giving up a little bit on the improvement. So there's always a balancing act between the amount of surface area we injure, the depth of injury, and those things all impact what technique we choose to use. Chemical peels have been around a long time. They're typically described as acid peels, and there's light peels that people can do in a medical spa, or even some salons and things do them. And then there's medium peels, which can be done with various types of acids, all of which are very good products. Jesner's solution and TCA is probably the most common acid that's used, which is a very powerful acid. But when used in concentrations of 10 or 15% are mild, and if we get into the 25 and 30% range, get higher, and I don't use higher than 30 or 35% at the very most. In most cases of 30% TCA would be the most of an acid peel I do, which I like a medium depth type of peel if I'm doing a TCA peel. And there's very good visual field feedback we get. We numb people when we do TCA, or any type of peel for that matter. But it can be done in the office, and it gives a nice even frosting. The skin gently exfoliates over several days. After the peel, it turns white initially, and then a little darker, and then it exfoliates. But my primary workhorse tool is a phenol peel, which is basically a benzene ring, but it causes what's called in our terms a coagulative necrosis, which is self-limiting in its depth of injury. And so when we do a deep peel with a phenol, 89% USP phenol, and there were other versions of the USP phenol too, but Baker-Gordon formula was one, and there was a Litton's formula, which instead of putting croton oil, which over time the peel got smelly when you mix it in the bottle, there's a different product used in Litton so you can store it longer. In each of those, if you had them in the bottle, you'd be shaking it up. But generally Baker-Gordon was mixed up for each patient, and the depth of injury was quite profound with Baker-Gordon's. Had to be used very, very carefully. And I saw a lot of patients over the years that have had lightened areas from too aggressive of these Baker-Gordon or deep, very, very deep phenol peels. The straight phenol, 89% USP, is a great way of doing it. It's self-limiting in its depth of injury. It still gets entire surface area, so commonly around the eyes, around the mouth. Has a little bit longer recovery period, and we see an initial frost followed by the skin layer, which we leave on there getting dark as it's starting to get ready to just come off, to shed. And so it's really the self-control, and that's left on, by the way, so it's a biological dressing. We just keep ointment on the surface. And then as the new skin comes through, it's pink to red, just like you skinned your knee, and that pinkness fades over time. So chemical peels fall into this category of one of the three types of resurfacing. And the three types are mechanical energy or sanding, dermabrasion, the chemical energy created by a chemical peel, which can be an acid or sort of a base, which causes different types, there are different mechanism of action in removing the outer layers of skin. And then finally, there's the light or heat energy types of resurfacing, which historically we really thought of that as lasers, but now there's radio frequency and other, which is basically like a form of cautery, which are ways of delivering energy and creating controlled injury to the skin surface. And every one of them does that, and they just do it in different ways. There's sort of light and heat, or there's chemical energy, or there's mechanical energy. And the peels are special in that they've been around for a really long time, and those of us who are lucky to have trained in peels, I think, have a wonderful tool that's an alternative to lasers, and my fellows all learn how to use peels, and it's a great tool, and they work very well. In fact, for a result that is lasting and meaningful around the mouth, the two most difficult areas to treat for wrinkles and lines, around the mouth and around the eyes, and deep chemical peels do a better job than resurfacing with a fractional laser in general. And if you're going to use full laser resurfacing, then the redness can last for over a year. And that was my experience with full laser resurfacing. And I think anyone that's doing full laser, I can do full laser resurfacing, I just don't do it anymore because the redness is too persistent. And it's pretty rare for that to happen with a deep chemical peel. So we think it's the heat, the excess heat or the extra heat, that is a benefit, but it's also a downside, because the redness always goes away, but if it takes a long time to go away, a year or longer, that's difficult for most patients. It can be disguised with makeup. In any of these resurfacing techniques, the side effects afterward, which are expected, are red skin turning to pink and then fading away over time, just like if you skinned your knee. And that can be a little bit itchy in the first week or so, but most any type of resurfacing in modern day, including chemical peels, the wound healing is complete by the acute phase of wound healing is complete by about 10 to the most 14 days. And the fractional laser, of course, is half that or less, but it doesn't give as good of a result as typically a full peel will. That means for us that I'll use combinations of deep chemical peels and fractional laser depending on the condition of skin. So if you have any questions about deep peels, we've talked about the light peels, which include glycolic and salicylic acid and light Jesner's peels and some retinol peels, or medium strength, which are TCA types of peels, and Jesner's can fall into that category. And then the deeper peels, which can be done with TCA, stronger concentrations, or with phenol type based peels. Then don't hesitate to give a call, and or send an email or a video or a photograph to drmaas.com. Dr. Corey Maas on looking and being your best.